Premature ejaculation, PE, is a common sexual dysfunction in men, characterized by ejaculation that happens sooner than desired, often within 1 minute of penetration. The exact causes of PE are complex and can involve psychological, biological, and lifestyle factors. Here's a detailed breakdown. Way 1. Psychological causes. Many cases of premature ejaculation are rooted in mental and emotional factors, including anxiety and stress, performance anxiety, general stress, or worry about satisfying a partner can cause overexcitement or inability to control ejaculation. Depression, low mood and self-esteem can affect sexual confidence and control. Relationship issues, emotional disconnect, unresolved conflicts, or lack of sexual communication can lead to PE. Early sexual experiences. Men who had rushed or secretive early sexual experiences may develop a pattern of quick ejaculation. Sexual conditioning. Masturbating quickly, e.g., in adolescence due to fear of getting caught, may train the body to ejaculate rapidly. Guilt and shame. Cultural or personal feelings of guilt regarding sex can lead to subconscious rushing. 2. Biological causes. Several physical and neurological factors can contribute to premature ejaculation. Hormonal imbalances. Low serotonin or abnormal levels of testosterone and prolactin can affect ejaculatory control. Hypersensitivity of the penis. Some men naturally have a more sensitive glans, tip of the penis, leading to quicker stimulation. Inflammation of the prostate, prostatitis. Swelling of the prostate gland can increase urgency and sensitivity. Thyroid issues. An overactive, hyperthyroidism, or underactive, hypothyroidism, thyroid gland can disrupt ejaculation timing. Erectile dysfunction, ED. Men struggling with ED may rush to ejaculate before losing an erection, reinforcing PE over time. Neurological conditions. Diseases like multiple sclerosis or nerve damage can affect ejaculatory reflex control. Genetic factors. Some men may have a hereditary tendency toward PE. 3. Lifestyle and external factors. Certain habits and lifestyle choices can contribute to premature ejaculation. Poor sexual experience and lack of practice. Infrequent or irregular sexual activity can lead to reduced ejaculatory control. Substance abuse. Overuse of alcohol, smoking, or drug use can interfere with normal sexual function. Unhealthy diet and lack of exercise. Poor cardiovascular health can affect blood flow and nerve function. Sleep deprivation. Poor sleep can lead to increased stress and decreased testosterone levels. 4. Types of premature ejaculation. PE can be classified into two main types: primary, lifelong. PE, present since first sexual experiences, often due to neurological or genetic factors. Secondary, acquired. PE, develops later in life, usually due to stress, medical conditions, or erectile dysfunction. Conclusion. Premature ejaculation is a complex condition influenced by psychological, biological, and lifestyle factors. While it can be frustrating, effective treatments exist, from behavioral strategies and therapy to medication and medical intervention. If PE is persistent and affecting relationships or self-esteem, consulting a doctor or sex therapist can be beneficial.